Hello everyone, welcome to the second last week of family medicine rotation. Today is Saturday. I'm here, I'm in the break room. Next week I'll be done family medicine. I'm going to do internal medicine, and it's been quite a hectic few weeks for me. There's a lot to say. I'm very ahead of schedule for UWorld. I finished family medicine within like the first 2 or 3 weeks. I finished ambulatory medicine afterwards, and now I'm starting clinical neurology. I'll put a photo of my schedule somewhere over here. In the meantime, I'm also spending a lot of time working with Mentor, and he's helping me a lot with research opportunities and also with global health. So I'm involved with that. That's taking a lot of my time, but I enjoy it and I love it, so it works out. My sleep schedule has changed drastically. I now wake up at 5 a.m. almost every day. I don't sleep early enough, which is something I should work on, but there's a lot I have to tell you guys. There's a lot I have to tell you guys about finding a mentor, the importance of that, how you should find a mentor, and why that should be on your radar as soon as you start medical school. But again, the sooner the better. If you haven't found one yet in second year, third year, fourth year, you have to start as soon as possible, because the character development, the personal development, the professional development that a mentor will help you attain is just going to be so drastic for your own growth. So on the way home, I'll talk to you guys about the whole mentorship thing, and we'll go from there. Bye-bye. All right, guys. So I forgot to record for you guys on Friday. Today is Monday. Today's Tuesday. I'm heading off, and it's the last week of my family medicine rotation. And I'm going to try to show you guys a day in the life in the hospital. However, it's difficult recording because there's patients around, there's doctors around, and you don't know how comfortable they feel. And I try to stay on the safe side. But regardless, one thing I want to tell you guys, it's very important, very, very important. Honestly, a cheat code to getting ahead as a medical student is finding a mentor early on. The earlier on you find a mentor, the better it will be for your career growth, for your academic growth, for your personal growth, because a mentor will help you get somewhere in 1 week or in 1 month that would have taken you 6 months, 7 months, 8 months to get to by yourself alone. And the reason for that is that when you have a mentor, a good mentor, you're able to tap into the resources, the networking, the insights, the guidance, the knowledge that a fully fledged medical professional has attained after 20, 30, 40, 50 years of working in the field. So if you're able to tap into that very early on in your career and show enthusiasm and discipline and work ethic, and that medical professional is, they're receptive to that, they're able to help you grow exponentially, at a rate that you would never grow on your own. I am very fortunate to find a very good mentor, and he's been very helpful to me. And in the past 2 or 3 weeks, I've been able to get access to so many unique opportunities that have shaped my perception of medicine, that have gotten me into rooms that I wouldn't have got into alone. Just to give you guys reference, my sleep schedule now is I wake up at 5 a.m. every single morning, only because the mentor that I had early on, his sleep schedule is that he wakes up at 3 a.m. because he's a surgeon. And he makes his calls at 4 a.m., 5 a.m., 6 a.m. And I need to be awake when he calls me and he talks to me about a research opportunity or he needs help with something, whatever that it is. So I adjusted even my sleep schedule for him, and it's honestly brought me so much growth and discipline in my own life. Like, I get so much accomplished between 5 a.m. and 9 a.m. when I have to leave to my clinical rotation right now in family medicine that previously I was never able to get. So to summarize all of this, find a mentor as soon as possible, someone whose career trajectory you want to emulate, someone who you admire, someone who you think is very wise and is able to give you advice and guidance on the kind of medical career that you want to build yourself. So that is my advice for now. I'm going to get going. I'm hopefully going to pick back up with you guys at the hospital, maybe in the break room, hopefully, when I'm charting or studying in between patients, or when we have a break. And if there's one thing you take away from this vlog, is to look into finding a mentor as soon as possible. And I'll show you guys the easiest way how in one of the segments afterwards. So I'll see you guys soon. So this is one of the rooms. For family medicine, we have inpatient and outpatient settings. This is my outpatient day. So this is the office, the EKG machine, we got the bed, we got all the different utensils, and this is where we take the physical exam. We do the history, full history, physical exam, and then we speak with the attending, we speak with the doctor, we basically present what we see, what we think, what treatment plan we think is indicated for the patient, and then they give their feedback, what they think. And they're sometimes in the room when we're taking a physical or the history of the patient, and that's very valuable because they give us feedback on stuff that we should do differently. All right guys, so now we're on break and the patients have been seen. Right now I'm in the break room, going to go through Anki. I'm going to go through the UWorld Medical Library to learn about a few conditions that I'm getting questions wrong on. And number 3, I'm going to try to reply to some emails before we start seeing patients again in approximately an hour or so. We are leaving our family medicine shift, considering going to sushi buffet for the lunch menu, but I have a lot to study. I'll put a photo of everything I need to study today over here. And I was gonna go, but then I'm like, you know what? If I catch up on all of this by tonight, I'm gonna feel a lot better than I will feel after eating sushi. So I made the executive decision to override my sushi cravings and to go study at home instead. So I'm going to drive home now. On the way home, I'm going to call my parents. I haven't heard my father's voice in a little too long, and I want to hear from him. I miss him a lot, and he's also my role model. So I have to talk to him, see how he's doing, talk to my mom, talk to my sister. We're off to a very productive start to our day. We woke up in the morning, we studied UWorld, and now we're going to continue that and hopefully go to the gym at night. Anyways, I'll see you guys later. Blah, 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 blah. All right, guys, we are leaving the apartment right now to go to the gym. I studied a lot of I'm doing clinical neurology right now for UWorld, for my question bank. So, as I was saying, I haven't studied the neurological syndromes ever since step 1. It's been a very long time. There's a lot of nuance and nitty-gritty details when it comes to neurology and neurological syndromes. So I thought about just not doing questions for 2 days, yesterday and today, and instead just reviewing the notes using the UWorld and AMBUS Medical Library. And today I just did a lot of the stroke syndromes, MCA, ACA, lacunar strokes, the brain shed regions, the management of stroke, etc., etc. So I'm going to start with questions again tomorrow. I'm ahead of schedule regardless by I think like a few weeks, maybe even a month. So I'm not stressed about doing questions every single day because I'm ahead of schedule. So I have that, flexibility. So anyways, let's go to the gym, and next time I see you guys will be the last day of my family medicine rotation. Hello, ladies and gentlemen. We are done. We're done family medicine. Normally I would be excited, but I know I have internal medicine next, and I'm not excited for that. 3 months of tracking sodium levels. I don't want to do that. But we're done family medicine. Normally I'd be happy. I'm just not. I don't feel anything, especially since I'm not excited for internal medicine. So the plan now is to just go home, review UWorld, go to the gym at night. I want to celebrate somehow, but nothing comes to mind. So that's about it, honestly. Yeah, there's not much to say. I'll see you guys later. Alligator.